Because apparently you don't have time for any other thing other than ambulance and something to work. So someone told my wife, for your husband, don't worry. The hospital and the ministry, those days it was the hospital, now the ministry, so he doesn't have time for anything. So you relax. You know? Thank you very much. Thank you. See, Honorable, Amam Bande, where are they? Call them for me, call them for me, call them for me. So, you see, the drovers have all these gadgets, thermometers, so they are loaded and stethoscopes and all. So it's a fully loaded system. Yeah. Otoscope. So this is what you use to look into the ears of people. So, yes, it is indeed. It is. Yeah.
Monitors and everything.
Monitors will be there.
Yeah.
Mr. Sabat,
Yes, please.
you now that it's very strict inventory. Whatever little is in, they document. And everybody, anyone who drives, signs that this is what he was given. Got it? Oh. Very good. Syringes and needles, they came already. Yeah, cannula. Reflector relevant. Catheters, urine bags. Yeah. Okay. A host of other things. These are connectors. Oh. So this is an inflator. Whatever you want to pump, I think there are items here that need to be pumped.
Yeah.
Whether it's a tire or whatever one wants to inflate.
We are live, so can you use the mic?
Yes. So a whole lot of items are in here. You can see it came with a whole lot of items that are needed in a standard ambulance. Yeah, you all recognize this by now. This is a thermometer, the stethoscopes right here, and these are all stethoscopes and a host of gadgets. What you saw, we earlier on showed you the oxygen system. That's here, right now here. So that you can see the cylinders at the background here. So that means the patient in this ambulance will get oxygen whilst on transit to a health facility. Now you see this is a defibrillator. This is a defibrillator, very useful. If a patient suffers, some cardiac arrest. Patient suffers cardiac arrest. This can be used to kickstart. This is a BP machine, and you see this is an infusion pump. Some of the drugs given to patients need to be given continuously for adequate action, but also it makes the of the care providers to be free to be able to do other things. This is a suction machine. So these are very important for patients who are vomiting or those who have secretions. So you can see the bed. So really, we are very delighted to have this here. You can see the place is very roomy. Thank you very much. Thank you.
Thank you very much.
Good.
Thank you very much.
Thank you. Always. Always work again. Don't let up push up. Never under that.
Now, pass the phone a lot.
Yeah.
He sort of undangan kayak apa itu? Wow, bidang semua loh dong.
The Honorable Minister of Health, Honorable Ahmed Lamin Samate, the Honorable Minister of Foreign Affairs, Honorable Tangara, and then representative from the Minister of Foreign Affairs, Dr. Sam, World Bank, the Deputy Permanent Secretary, Honorable Usman Silla, the Chair of the National Select Committee on Health, Women and Children and Gender, the media personnel, colleague DPS Technical, DPS Finance and Admin, Director of Pharmaceutical Services, Director of Public Health Services, colleagues from the Minister of Health, colleagues from the Minister of Foreign Affairs, colleagues from the media, I would say good evening and welcome to the airport, where we are witnessing the arrival of the cargo plane carrying 10 ambulances with medical equipment and as well as supplies being brought by the government of the Gambia, facilitated the arrival by the World Bank. So I will now allow the Honorable Minister to give a statement, but before he comes in, Would you mind I allow the and I will start with Honorable Silla first to say a few words, and then Honorable Tangara will come in, and then the final statement will be done by the Honorable Minister of Health. So Honorable Silla, you're most welcome to say a few words.
Officials from the Ministry of Foreign Affairs, Minister of Health, and the media fraternity present here. I feel very excited to be invited to this great day, in the sense that it's a day that the country is receiving a set of equipment and materials that are needed for the fight against the pandemic that we are confronting as a nation. The issue of these supplies, medical equipment and materials, had been brought to the attention of the National Assembly, particularly the Select Committee on Health, and we have been looking forward to witnessing the delivery of these items. I don't have much to say, but just that we believe that this is going to be a boost, not only to the response to COVID-19, but as we are supporting the process for the development of a robust, effective, responsive healthcare delivery system. These deliveries are going to help in that direction, that the Gambians deserve affordable healthcare, Gambians deserve accessible healthcare, Gambians deserve real-time attention in terms of healthcare, Gambians deserve affordable and quality healthcare. And we believe that with these ambulances, there are communities that are far off and would need medical attention. But for them to benefit from medical attention, real time, lack of mobility has been a challenge. So we are hoping that these ambulances are going to be distributed evenly. Of course, we need more than this in terms of numbers for the country. But with this, with a start, we believe that each of the regions is going to have one. I don't know how they're going to do that, but we want Gambians to benefit from this, because at the end of the day, it is taxpayers' money that is going to, it is a loan, they're going to pay for this. And as you know, I think the minister will delve that in that at length as to how this came about. But for me, as oversight, my presence here just to see the delivery, witness it, and then looking forward to witnessing this equipment and materials serving the real purpose that they are intended for. So on that behalf, on that note, I wish to thank the Honorable Minister and to congratulate the Minister of Health for these things, that this is going to be a real boost in your work, and to also assure them that as oversight, we are not adversaries at the level of the National Assembly. You complement each other. We are just there to ensure that there is oversight for the executive to deliver. And I wish to inform you that as at now, there is that supportive relationship between the National Assembly and the executive. We are really talking. We are really seeing eye to eye, and we are not, of course, dropping our guard. We have our oversight, but they are really responding to our oversight. Let me put it that way. So on that note, I have taken so long in just giving you a brief remarks as far as I see this event. But it's a landmark event. I can put it that way. Thank you very much.
Staff of the Ministry of Health, staff of the Ministry of Foreign Affairs, the media, the security. I will say I'm speaking with a mixed feeling. I would have said in normal circumstances that I'm very happy to be part of this landmark event, receiving state-of-the-art ambulances. But we are in an exceptional situation where we are faced with a pandemic. And I want to seize this opportunity to thank and commend His Excellency the President for the foresight and the guidance. Thank the chair of the COVID task force, but special commendation goes to the Ministry of Health under the dynamic leadership of my brother and colleague, Dr. Samate. I know today he will sleep peacefully because the delay in receiving these equipments and ambulances were giving him sleepless night. We are happy today that we are here to receive them, and we hope and pray that it will be put into good use. And we hope that not many people will need to use them. They are beautiful, but we do not wish to be in ambulances. But we are delighted and we have a sense of relief today that the ambulances are here. And this is also an opportunity once again to urge and encourage people to respect some of the measures taken by government. It's not with pleasure that some of the measures are taken. As I always say, we are trying to protect people against themselves. We are trying to protect ourselves and our families because the pandemic is real. COVID-19 is real. The fact that people are still in denial is very worrisome. But we hope and pray that God will save us from this terrible pandemic, and we want to pray for the good health of all the frontliners, the health workers. These are the real soldiers, the real heroes these days. And we commend the minister for all the commitment, the dynamism in leading the process. Thank you.
Statement, and we know the Honorable Minister will tell you the materials, what are here, in their quantities. He has worked tirelessly with this entire team to make sure that these materials are available. And also thanks to Dr. Samuel Mills, who have also been supporting the ministry in getting these materials to be available in the country. So, Honorable Minister, you have the floor to give your statement.
The Honorable Minister for Foreign Affairs, Honorable Mamadou Tangara, the Honorable National Assembly Member for Banjul South, Honorable Banjul North, Honorable Usman Silla, Madam Halima Sise, the Director for Asian Affairs at the Ministry of External Affairs, the Director for Health Promotion and Communication, Mr. Njai, Dr. Samuel Mills. I will talk about him later on. Now, Mr. Baban Ninsabali, the Director for National Pharmaceutical Services, all of you with your teams, our two Deputy Permanent Secretaries, Madam Fanta Baiseka, Mr. Karamba Keita, all the officials from our ministries here present, distinguished ladies and gentlemen from the media, we are delighted to stand before you today to witness the arrival of these items from the Republic of Turkey. Now, I'm sure you have all seen what we have received today. We stand here to receive 10 state-of-the-art ambulances for the people of this country. Now, we had never seen this before. I had never seen ambulances like this in this country before in my life. Today we receive these kinds of ambulances that are state-of-the-art, that are ready for use for the provision of quality healthcare delivery services in the Gambia. As mentioned earlier by Honorable Silla and Honorable Tangara, the people of this country deserve the best. We do not deserve any substandard care. Our standards, our bars are very high, and we want to reach those bars because the human body is the same whether it is in the Gambia or it is in Europe or it is in America. What is good for people in those communities is exactly what is good for our people here. But before we go in to the statement proper, at this juncture we have to thank His Excellency, the President, Adama Barrow, for his foresight, his commitment, his support to the health sector. He has been a pioneer in his efforts in providing quality healthcare services to the people in this country. We had numerous discussions with regards to improving what was inherited in the Gambia. And each time we went to him, all he said was, you have the political support, you have the political commitment, and we are behind you. You just tell us what you want to do and we will support it. And with that leadership, that is what is emboldening us to be able to do what we are doing in the health sector and also say what we are able to say in the health sector. So we thank the President, His Excellency, for his leadership, for his exemplary leadership in supporting us in the health sector. At this juncture, we also thank the COVID Cabinet Committee that is chaired by Her Excellency, the Vice President. My colleagues are here. We meet very frequently, a minimum of twice a week, to discuss the COVID-related issues. We debate at length in trying to put forward strategies that are the best for the people of this country. And of course, we cannot go without thanking Honorable Silla again, because Honorable Silla has been very supportive at the committee level, at the plenary level, virtually everywhere. He has been very, very supportive. Yes, as he said, their responsibility is oversight. But oversight, we call it constructive oversight. Oversight that is meant to share ideas. Oversight that is meant to give guidance. Oversight that is positive. Oversight that we can always sit with and discuss. That is why most of the important occasions that take place, that is spearheaded by the Minister of Health, he is there. That shows the level of support. To Honorable Tangara, of course, we have been in this together because this had to be sought from outside in Turkey. The logistics, the arrangements, the coordination, he had been in the thick of things with the common aim of getting to the Gambia what we need, and we thank all of you. Dr. Mills, as he's standing behind there, very unassuming, but I must tell you, he has been the brain behind this. Dr. Mills happened to be here to help us put forward our proposal for the next funding cycle of the World Bank support to the Gambia for the health sector. By the way, that had been increased because of the exemplary leadership of His Excellency and the leadership at the Ministry of Health. The World Bank has even increased their support to the Ministry of Health, to the Gambia, to up to 40 million for these next few years. Now, he was here to help the country develop that. Then COVID-19 came into reality and he actually got stranded here. But the time has been worthwhile spent. He raised these funds for us through his contacts, through his foresight, through his negotiations to get us the $10 million US dollar support from the World Bank. Together with the Minister of Finance, we thank him very much, Honorable Mamburinjai. They work on this funding support for us, and we are seeing the results of that. But Dr. Sam has been very instrumental in making sure that these items were procured and in making sure that we receive them here today. And we thank you, and the people of this country appreciate you, appreciate your support. And we also want to send our gratitude to the World Bank Group for this support to the Gambia, and we reassure them that all the support that they are giving to the health sector will be put to very good use, and we have seen that manifested today in the arrival of these ambulances and these goods. Now, COVID-19 came. It is unprecedented times. We have our frontline health workers who are there in the thick of things. We want to show appreciation. We want to send our respect to all of them. As you have already known, some healthcare workers have tested positive as we speak. Our prayers go to them and their families. We support them, and we tell them that the Ministry of Health, the government of the Gambia, and all our partners are with them in prayers and support, and we continue to support them. We want to tell them that the people of this country appreciate their hard work, their dedication, their commitment to duty, even when their health and their lives are at risk. We had lost a colleague in the health sector. You would all have known about him. We do not mention his name because of his privacy and based on the request of his family. That's why I would have wanted to mention his name here, but out of respect for each of the family, but we want to pray for him, for Allah to grant him Jannatul Firdaus, and to reassure the family that they will never be forgotten in this struggle of ours. Now, we want to tell the people of this country that this is a manifestation that the COVID-19 funds, the COVID-19 support from the partners will be put to very, very, very good use. We have already seen that, and the arrival of these 10 brand new state-of-the-art ambulances is a manifestation of that, and that we will guard relentlessly to make sure that every butut of the funds of government geared towards COVID-19 and all the funds from the donor partners are put to very, very, very good use. Now, these items we are receiving now are from the World Bank support, and we thank them very much. And there is a lot more that we will still have. We are still expecting. We are still expecting a whole lot of items for the health sector. This COVID-19 is a difficult time. Hopefully these ambulances and these items, personnel, protective equipment and other gears will be put for the provision of services to the COVID-19 patients. We also assure you that inshallah they will also be used by the people of this country after COVID-19. So I think it's a big opportunity to strengthen the health sector, to make it ready for use for the people of this country as and when the need arises. Once again, I wish to thank you all for your kind attention. Thank you very much. Thank you.
All right.
Thank you.
We'll have just a few questions. Could you please explain how the distribution, process will be done? Who will is expected, to benefit from this, from
yeah.
this
So our logistics team is going to sit down and analyze where the needs are as we speak, because primarily they are for the COVID-19 response. So they are going to be distributed based on strategically where they are needed. Yeah.
Okay, roughly how much was spent on this?
Now, the total amount that is spent on the ambulances and then the other materials is $3.9 million. So the items that the plane was able to bring is what it brought, but some items are still over there and they will also be shipped.
So, Honorable Minister, at the National Assembly, it was announced that Gambia will benefit from 33 ambulances. We've seen 10 today.
Yes.
Is that still, the point that we
That's
can
still
expect?
the point. That is still the point. So still the Gambia will receive 23 more in addition to this, because we want a system whereby after COVID-19 we have a very strong ambulance system in the country, whereby referral will be made easier for our people. Because you and I know that people have lost their lives in trying to get to the hospital because there is a delay in getting them to the hospital because they didn't have access to ambulance services. and we want that to be a thing of the past in this country.
Yeah. The final question, over the past days, few weeks, we've been seeing a rise, in the number of, cases, more than 50%, rise in number of cases, in this country. Is it because we are testing more? That is why, we're seeing more cases today?
No, in fact, it's not. It's much more than 50%. It's more than 200%. So that is the reality we have seen. So it's because we are gradually getting to the time that we said is going to be the peak. But also because when our neighbor Senegal opened, when they lifted the internal restrictions, that saw influx of a lot of Gambians from Senegal coming back, so that brought in a lot of cases. But of course also, because people also are not heeding the social distancing and the use of the mask. So we go again to emphasize, please let us maintain social distancing, let us refrain from social gatherings as much as possible, let us maintain the sanitary habits, hand washing, let us use the mask. In fact, all the things we learned about COVID-19 prevention previously, they are more relevant now than even before. Thank you very much.
Thank you.
Thank you. Yeah.